Hello everyone. Today I will be discussing simulation and how this learning method can be applied in healthcare education. In 2016, Pennsylvania College of Health Sciences opened their brand new campus. Within the campus, the 23,000 square foot Center for Excellence in Practice can be found. This impressive simulation lab contains 40 patient rooms with 24 beds, a realistic operative suite complete with diagnostic imaging equipment, and 18 high-fidelity simulators. Some people may ask themselves, why did the college dedicate so much time and money and space to a simulation lab alone? Is all that really necessary? The answer: simulation is the future of healthcare education. To begin, we will start by defining what exactly simulation is. Simulation is a trial and error method of teaching whereby an artificial or hypothetical experience is created that engages the learner in an activity that reflects real-life conditions but without the risk-taking consequences of an actual situation. I'm sure we can all relate to our first day in simulation lab where we were feeling quite nervous about performing our nursing skills for the first time. Now looking back, we can see how simulation has not only helped improve our clinical skills, but also our bedside manner. Simulation is primarily used to teach clinical reasoning and establish high-level decision-making. It is done so in a safe and controlled environment in which problem-based learning is developed and competencies are practiced in high standards. The simulation process is quite simple. Prior to the simulation session, the instructor must prepare the students and welcome them into a warm and positive learning environment. This makes the students feel at ease and indirectly lets them know that this is a learning environment. The simulation process has 4 core components, also shown on this slide. The first component, exposure, consists of introducing the students to the problem they are about to encounter during the simulation. This may also be referred to as briefing. The next component is sequence and is defined by progressively escalating the complexity of the situation presented within the simulation. The third component is feedback, and it refers to the continuous exchange of information between the instructor and student. Feedback may also be provided in the debriefing that follows a simulation session. Debriefing is the most important component of a simulation session and refers to when the instructor and student reflect on the simulation session and discuss the student's performance. The fourth step is referred to as repetition, which provides improved retaining of knowledge learned during the simulation session. Simulation may fall under 2 domains. The first is psychomotor, or the skills domain. Students are taught several clinical skills in the simulation lab. After observing, students then perform these skills independently. These skills may be repeated several times until the student feels confident in their technique. Students are then asked to demonstrate their skills in the simulation scenario. The second domain that simulation falls under is cognitive, or the thinking domain. Prior to the simulation session, students are taught theory within the classroom setting. This may be done through lecture, reading, or viewing instructional videos. The theory that was taught in the classroom can then be applied in the simulation session. This helps improve clinical skills and also reinforces learning. There are several advantages to simulation. The first is the ability to practice in a safe environment. Being able to learn in a controlled environment removes the anxiety and stress of a real-life emergency. It gives students a space to continuously practice their clinical skills that they will not have in today's healthcare environment. Simulation can also be used to facilitate interdisciplinary communication and collaboration. Nursing students may also portray other roles within the simulation session, such as doctors, family members, or other support staff. This allows for students to be able to build their communication skills as well. Simulation may also be used to decrease errors in healthcare. According to Jones et al., simulation is an innovative approach of learning based on mistakes. By participating in simulation, students can build on many of the core competencies. Thus, the correct skills can be acquired to prevent and cope with errors in medical practice. There are few disadvantages to simulation, and most of them are directly related to its cost. The first and most obvious is the equipment cost of creating a simulation lab. The cost of building a sim lab can be difficult depending on the facility's budget. Costs may not only be related to affording the equipment necessary, but also the staff required. It may be expensive to train faculty to be able to run the scenarios, and finding the appropriate personnel that will supervise the simulation lab itself. The cost of IT support may also be quite expensive. Most of the equipment within the simulation lab is technological. IT staff needs to be properly trained on how to fix technology issues should they arise. There are several examples where simulation can be used in healthcare education. As I had previously mentioned, simulation is used within the classroom, for example, when we were all in nursing school. Simulation is also used during CPR classes or parenting classes. We use adult or newborn mannequins and they perform CPR. Parents may perform diapering or swaddling on the mannequins. Another thing that we were told in nursing school, which I had never got the chance to use, was an online virtual reality simulation. So you can go online and just type in virtual reality simulation and you can go on, choose the website, and you get to pick the scenario that you wish to do. And then you basically make decisions by clicking and the simulation progresses based on your choices. Another is simulation within the unit that you work for. In relation to my area of practice, nurse educators are constantly conducting postpartum hemorrhage simulations within our unit to better prepare our staff should the incidents arise. Postpartum hemorrhage is one of the most preventable causes of maternal mortality. In 2016, the Association of Women's Health, Obstetric and Neonatal Nurses developed the Postpartum Hemorrhage Project to reduce clinician errors with obstetric hemorrhage mortality and morbidity by improving clinicians' recognition of, readiness for, and response to a postpartum hemorrhage event. This is done by providing simulation to the staff of the hospitals who participate in the Postpartum Hemorrhage Project. Click the link on the slide to watch the short video on how the use of simulation helped improve patient outcomes in this area of practice. In conclusion, the use of simulation as a learning method is an excellent resource in healthcare education. Simulation provides a safe environment in which healthcare professionals can learn the skills necessary and become confident in their roles. There are numerous advantages to using simulation that seem to outweigh its only disadvantage of the costs involved. As for the future, simulation in healthcare educational programs will be seen more frequently as the use of simulation as a teaching method is extremely beneficial.